Okay. Hi, everyone. My name is Nick Jelicic. I'm a PhD student at the Clinical Operational Research Unit at UCL. And I started my research a couple of years ago now during the pandemic. And one thing that the pandemic did was that it showed the need for infection control within hospitals because it was really important for vulnerable patients to not catch COVID. But another thing that we probably remember about the pandemic is that it was important for these policies that hospitals were nearly at capacity. So it was important that these policies not use up too many resources, which would be needed to maintain a good level of flow. So this was one of the key motivations for my research, which was investigating the consequences of infection control decisions using mathematical and simulation models. So hospitals are environments where there's a huge potential for spread of infectious diseases. Firstly, just simply because there's patients that come in with infections themselves. And secondly, because it's an indoor environment, which naturally lends itself to more spread of disease. But patients catching infections is a really bad outcome because it can have really severe consequences on their health and on their care. So because of this, policies need to be brought in to mitigate the spread of infection. But when bringing in these policies, infections can't be the only consideration, because the only way to guarantee no infections would be to completely close the hospital or large areas of the hospital. But then there would be lots of patients missing out on the care that they need, which could be very urgent. So there's therefore this kind of trade-off to consider. So the problem is to choose policies which keep infections down, but maintain a good level of flow. So through conversations with key decision makers, we found that choosing policies can be difficult when faced with these trade-offs. We also found that decision makers are faced with high pressure and fast-paced environments where they have to make critical decisions quickly. So because of this, we've developed a model to quantify the impact of different decisions and to provide insights into this trade-off. And our model also provides various ways to help decision makers to decide between policies. So for the rest of the talk, I'm going to use just one illustrative example to try and demonstrate the types of modeling that we've been doing and how it can help decision makers in practice. So here's a diagram showing an open bay in a hospital. And there's a patient who was just detected as being infectious with some infectious disease. So that patient is then removed to isolation in a side room to reduce the risk that they might spread the infection onto anyone else in the hospital. But typically, that patient was infectious for some period before detection because they might have been asymptomatic, for example. So during that period before detection, the contacts were exposed to this infection. So there's some risk that they're now infected as well. So the question is how to deal with this risk that the contacts are infected. So the first thing you could do would just to keep the bay open, so simply just means to do nothing. So you allow arrivals to the bay as normal, and you allow patients to leave to any other location. And the benefit of this is that it maintains a good level of flow, but any arrivals to the bay could be at risk of infection from the contacts. And if they're allowed to spread to leave to other locations, then they could spread the infection to other locations. So I'm now going to play a simulation showing a demonstration of how our simulation model works in practice. So at each time step, there's several events that can occur. And you don't need to pay any particular attention to any events because this is a randomized simulation. But there are a set of metrics at the bottom which update with the simulation. So an outbreak occurs if there's an infection in the other bay, and the throughput is the number of patients that have been in the focus bay. And these are the consequences which we deem to be important to relay in terms of making decisions. So by the end of the quarantine period, we see that the infection is spread to other parts of the hospital, which then could get out of control. So because of that, another policy that we could bring in would be to close the bay for some predetermined quarantine period. So this means no arrivals would be allowed to the quarantine bay and no departures would be allowed to any other open bays. And the benefit is that this is much more likely to contain the infection to the quarantine bay. But there's going to be some wasted capacity for this quarantine time because there'll be at least one bed that's empty. And if arrivals are blocked from coming into the quarantine bay, they could then become medical outliers, meaning that they're sent to a ward that's not suited for their medical needs. So again, I'm going to play a simulation of how this might play in practice. And I just want to reiterate, this is a random simulation. So again, the particular events are not of massive importance in this presentation. But the probability of each event is determined mathematically, and then the simulation chooses one of these events at random based on these probabilities. So the simulation is run thousands or millions of times, and it gets to give a prediction of what the consequences of a particular policy would be. So we see, as we come to the end of this simulation, that the infection was successfully contained to the quarantine bay. So I've described the problem, and I've shown how our model can estimate the consequences of different policies. But now I'm going to describe some of the ways that it can actually be used to help decision making in practice. So the first thing that you can do, this is an example scenario showing different estimates for different metrics based on different policy options. So the policy options are listed on the left-hand side, and the metrics or the outputs across the top. So the outputs in the table are listed green if they're at a good level, amber if it's a cause for concern, and red if it's at a very concerning level. So decision makers will be able to look at this to have a reliable assessment of the consequences of each policy, and could then use this to make a more informed decision. But perhaps this is still not quite so easy to make a decision based on this table. Maybe deciding between policies is not quite still so easy. And choosing a policy based on this could still be time consuming. So because of this, one other capability of our model is to describe situations where different decisions are preferable. So we start here with two graphs demonstrating the effects of arrival rate on infections and on throughput. And arrival rate is the number of patients that arrive at the bay per day. So we see that as the arrival rate increases, then closing the bay becomes increasingly preferable in terms of minimizing infections, but increasingly worse in terms of patient flow. But again, this is quite difficult information to use practically. So to make these graphs useful for decision makers, we need to define a tolerance level on the number of infections. So the background risk of infection in a hospital is never going to be zero. There's going to be staff or visitors who might come in who have contracted an infection from outside and then might pass it on to patients. So you have to be willing to tolerate some chance that patients will be infected. So suppose that decision makers decided that they were willing to tolerate 0.5 expected infections after a policy is implemented. Then what we do is we draw this line on the graph, the red line on this graph, and we find the point of intersection between the tolerance level and the infections for keeping the bay open. So then for any arrival rates above that intersection value, then the amount of infections, if you kept the bay open, would be more than the tolerance level. So keeping the bay open would be an intolerable policy, so you should close the bay. But for any arrival rates below that value, then the policy is tolerable because the infections would be below the tolerance level. So, and we know from the previous slide that it's better for patient flow, so you should keep the bay open. So therefore, we managed to provide more general rules of thumb so that you could just look at the arrival rate in your scenario and make your decision accordingly, which would massively speed up the process. Of course, in practice, in reality, it's not quite this simple. There's lots and lots of variables affecting decisions which interact. So you can't just look at the arrival rate. But we've been working to translate this analysis to much higher dimensions so that we can still do this analysis and we can still help with decisions. So to summarize, decision-making in infection control is really difficult, and because policies have an impact on infections and on flow, and it's really difficult to consider this trade-off. So because of this, we've developed a model to quantify the impact of policy options. And we've used this model to provide various insights which can help decision makers, including giving estimates for particular scenarios, and based on a tolerance level of infections, determining situations where different decisions are preferable. Okay, so I'd just like to thank this institute for funding this research and my supervisory team for their contributions to this work. And if you have any questions, please contact me by email. Thank you very much for listening.